I came to Aadland Dental today to get some implants. It has been something I've been thinking of doing for 42 years. I got hit and I busted my tooth out and made my mother sick because I had the best teeth in the family. So Dr. Aadland explained to me that she was going to put in 2 implants today, and I was pretty thrilled about all that. She said they'll have a nice smile, and that really impressed me.
So for our patient today, it was really fun. He came in and he was missing 2 teeth. He'd had some trauma to his front teeth, so he was missing a front tooth. The tooth next to it is also a little bit loose, and so we know we're going to need an implant down the road, but we decided to make a treatment plan that was kind of be extended to give him a front tooth to be solid first before we remove the second one. He was also missing tooth number 13, which is an upper left premolar, and he was ready for some implants. In our initial exam, we take a cone beam machine, so it's a 3D image of the jaw, and then we also scan with our CEREC machine, which gives us a 3D rendering of the teeth and the gums. And we merge that information together, which allows us to virtually treatment plan the implants. And we get to do that in front of the patient, which is great because he has a good visual of what we're going to be doing in our actual appointment. So it breaks the implant sequence into 3 appointments. We do our initial scans, and then the second appointment is surgery, which is also what we did today. And then our third appointment is when we're going to deliver the final restorations, which we're also going to make with our CEREC machine. So for the patient, it's only 3 appointments from start to finish, and I think that's huge in today's world. Guided surgery for me gave me a little bit of security, and it did that in a couple different ways. One, just having the guide already planning the implant both on the computer, and I can do that either by myself and make my own guides, or I can use a third party to help me with the guide. The advantage of the third party is that I have someone else with eyes on it that see implants every single day. And they virtually place the implant, but I have total control over it. So I get the plan back, and if I want to place the implant a little deeper, I can. If I want to move it, I can. So once I approve that, I just click a button, approve, and then they design the guide for me. And literally it will show up on my computer with a print button. I just hit the print button, it gets queued to my Sprint Ray printer, and then it takes about 40 minutes for that to print. Once it's printed, then we put it in the wash station, and then after that I put it in the cure box and I put my sleeve in there according to the plan of what I'm using for the implant. So then when it comes to surgery day, my guide is ready. I try it in and I go down my checklist and make sure everything fits. And the guide just gives me so much comfort knowing that the implant's gonna go exactly where I want it. I don't know if anyone's ever excited to visit the dentist, but we do everything we possibly can to make it exciting. And technology helps with that too. This patient, he was a machinist, and so he does this in his world as far as mechanics and machining. So he was so excited to see our CBCT with the 3D renderings, our CAD/CAM units. Our milling machine is like a CNC machine, which is very similar to all of his mechanics that he works with. And then of course 3D printing, which is so prevalent in all of today's world. But in dentistry, that's how we make our guides. So I've been placing implants again the last couple of years, and it's done tremendous things for my practice. Both for me, I'm excited now to do something new, but also my team members are excited because they get to do some new procedures as well. And it gives them other opportunities to not just sit chairside and just use the suction. They actually get to design on the CEREC, and they get to print and make guides and do all of those kind of fun things. And so it just adds to their day as well. It's not quite as monotonous. I would say if you're interested at all in placing implants, just start the journey and take the time and invest in your team and get them trained. And I would just say go for it. You don't have to do this full commitment where you have to do full arch implants or anything. I do a lot of abundant bone, easy implants that get me through the day. I don't want to do the scary things, but it still makes me so profitable to do those just good, simple, straightforward cases, and I'm loving it.